of Healthcare's novel flagship event, National Stroke Conclave 2023, supported and endorsed by Indian Stroke Association. Today, we are all here to embark on a significant journey, uniting under the common purpose of advancing stroke care and management. And along with the immense support of Indian Stroke Association, the event partners who have helped us to put together this event today, our supporting partners, Quality and Accreditation Institute, Association of Healthcare Providers of India, Indian Federation of Neuro Rehabilitation, World Rehabilitation Alliance, our care partner Apollo Hospitals, institutional partner Indian Institute of Public Health, industry partners Omron, Lyceum, MQ Pharmaceuticals, Boehringer Ingelheim, Torrent Pharma, and Intas Pharmaceuticals. Thank you so much for putting this show together with us. This conclave has been meticulously crafted with a singular goal in mind: to provide a comprehensive platform for all the stakeholders in the healthcare industry to come together and deliberate on the innovation, partnership, and policies in the intra-industry partnerships and policy landscape around stroke care. Through collaboration, knowledge exchanges, and discussions on innovative technological solutions, we aim to provide changes and advancements in the field of stroke care and its management. The overarching goal for today is to try and navigate a path towards a better future where strokes are not only just managed but somehow prevented, and where every patient receives the quality of care which the one deserves. Our agenda is rich and varied, addressing crucial points that form the foundation of stroke care. We will delve into subjects like strengthening symptom recognition, enhancing public health awareness, and refining stroke management. We'll also be navigating the intricate policy landscape that exists now to create a robust foundation and for prevention and management. We will advocate for quality-driven care, placing accreditation and standardization at the base, and excellence of stroke care. And while we discuss about quality, while we discuss about strengthening symptom recognition, in today's day and age, how can we forget and not include technology? So we will definitely be talking about how technology is now helping us making the stroke care much better. Along with the engaging discussions, I'd also like to bring to your attention the first of a kind initiative taken by Voice of Healthcare. Now, throughout the conference, while we were delving into discussions, how we are framing the conference, along with our supporting partners, we got a chance to interact with so many stakeholders that are surrounding stroke care management. And it only took a few initial responses to realize the importance of the care providers who are serving at the forefront of stroke care. And we decided to take the honor and recognize the remarkable efforts and contributions that our exceptional leaders have been tirelessly putting in to serve their best for stroke management. And therefore, I would also like to announce Voice of Healthcare Stroke Innovation and Excellence Awards 2023. A set of recognitions under various categories as per the verticals of the care industry that are functioning and contributing for stroke care. We started the process of receiving nominations almost somewhere around a month ago or so, and I'm happy to let all of you know that we've received an overwhelming response from the industry. After a careful deliberation from all the received nominations, our expert jury panel has shortlisted the recipients of awards and certificates of distinction holders. The award ceremony shall be taking place in the later half of the day, and that's just not it. To felicitate all our winners, we will be having the honor of having with us our chief guest for the day, Shri Rushikesh Ganesh Bhai Patel, Minister of Health and Family Welfare and Medical Education, Higher and Technical Education, Law and Justice, Government of Gujarat. Sir would be present here with us during the award ceremony. Therefore, to all the esteemed speakers, panelists, participants, I urge all of you to be present till the award ceremony. Therefore, I also urge all of you to engage wholeheartedly, share your insights, share the experiences, and forge connections that will help us build a better stroke management institute. And with that, let the National Stroke Conclave begin with the lamp lighting ceremony. I'd like to request the following to step in front and light the lamp for a formal commencement of today's conclave. Dr. Naveen Nishchal, Chairman, Voice of Healthcare, sir, please come in the front. Dr. Anand Alurkar, Dr. Arvind Sharma, Dr. Jeyaraj Pandian, Mr. Neeraj Lal, Dr. Sudhir Shah, Dr. P. Ganesh Kumar, Dr. B.K. Rana, Dr. Deepak Saxena, Dr. Rajendra Dhamija, and Ms. Pinky Chahar.
शत्रुबुद्धि विनाशाय दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोस्तुते ओ दीप ब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीप ब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Thank you so much.
त्वं कल्याणम्
And with that, to set the tone of the day, without any further ado, let us commence the inaugural session for the National Stroke Conclave with the theme of Innovation, Partnership and Policy. Allow me to welcome the speakers for today's inaugural panel, and please welcome everybody with a huge round of applause. Dr. Naveen Nishchal, Chairman, Voice of Healthcare. Sir, please come up on the stage. Dr. Anand Alurkar, President, Indian Stroke Association. Dr. Arvind Sharma, Secretary, Indian Stroke Association, Board of Director, World Stroke Organization, Executive Member, Indian Academy of Neurology, Director, Brain Heart Foundation, Ahmedabad. Dr. Jeyaraj Pandian, Professor of Neurology and Principal, Christian Medical College, Ludhiana, President-elect, World Stroke Organization. Dr. Nirmal Surya, Chairman, Surya Neuro Center, Regional Vice President, World Federation of Neuro Rehabilitation. Mr. Neeraj Lal, Chief Operating Officer, Apollo Hospitals International Limited, and Technical Committee, Stroke Standards, QAI. And Mr. Rohit Shukla to please come up on the stage. Can we please have a huge round of applause for the inaugural panel today? To give his opening remarks, I'd like to welcome Dr. Naveen Nishchal to please come up in the center and begin the opening address.
Thank you, Kushbu. Respected Dr. Anand Alurkar, Dr. Arvind Sharma, Dr. Nirmal Surya, Dr. Jeyaraj, Dr. Sudhir Shah, Neeraj Lal, Dr. B.K. Rana, Dr. Deepak Saxena, Dr. P. Ganesh Kumar, Dr. Rajendra Dhamija, Mr. Rajeev Arora, all neurologists, and all innovators in stroke care. Very good morning, and very warm welcome for National Stroke Conclave 2023 on behalf of Voice of Healthcare. This is for the first time when Voice of Healthcare is conducting a conference and bringing all stakeholders of stroke care onto one platform. Be it clinicians, innovators, policymakers, quality stalwarts, we are bringing everybody on this platform. And all credit goes to Indian Stroke Association. IS is truly creating an impact in stroke care. On this platform, I want to raise a pertinent issue here. Being the second most common cause of death amongst various diseases, stroke doesn't get enough importance, while myocardial infarction steals all the spotlight. My first close encounter to stroke was early on my clinical career, when I was doing my post-graduation, when I was doing my MD medicine. And I picked up my thesis topic, and my topic was carotid color Doppler in cerebral infarction. And during that time, I closely watched all those patients and understood the value of quick care and importance of time in stroke care. You know that majority Indian population doesn't have access to stroke-ready hospitals. Imagine a common situation in a tier 2 or tier 3 town where a stroke patient rushes to emergency in a nursing home and then to a diagnostic center for getting CT scan done. And by the time patient returns back to this hospital, substantial damage has already occurred. And when I look back, my entrepreneurship journey, especially creating hospital in tier 2, tier 3 cities, my early experience shaped my thought process. My philosophy of creating these centers was providing emergency care in golden hour period. I set up 150 bedded hospital in tier 2 and tier 3 town cities where you get all the facilities under one roof, like CT scan, cath lab, modular OT, full-time neurologist, cardiologist, neurosurgeon, so that I can take care of all these patients in emergency. During my entrepreneurship journey, I touched 70,000 patients per month, 8 lakh patients every year, and in this stint, I touched more than 4 million lives. And I'm happy to say that I helped a lot of stroke patients during my entrepreneurship journey. Before I conclude, I would once again would like to thank and congratulate ISA and ISA members for making stroke an emergency agenda, a big agenda, and this is need of the hour. So today we have some good panelists, some amazing speakers from all over the country, and I think we are going to have some good learnings. Thank you very much. Thanks a lot.
Thank you so much, sir. I'd now like to welcome Dr. Arvind Sharma to please come up on the stage for opening remarks. Can we please have a round of applause for sir?
Thank you, Khushbu. Thank you very much. It's a great journey for Indian Stroke Association, and as a Secretary for Indian Stroke Association, I would like to welcome the dignitaries on the dais, Chairman for Voice of Healthcare, Dr. Naveen Nishchal, our President, Indian Stroke Association, Dr. Anand Alurkar, President-elect, World Stroke Organization, Dr. Jeyaraj Pandian, who is also past president of our Indian Stroke Association, Mr. Neeraj Lal, CEO, Apollo Hospital, and we have a people voice with us, Mr. Rohit Shukla. And it's a voice of healthcare, so people's voice. And all the dignitaries in the audience, Director Ibhas, Dr. Dameja, CEO, QAI, Dr. Rana, IAPH Director, Dr. Deepak, and Dr. Sanjay Saxena, Dr. Kumar Velu. It's an honor to all the delegates who are here present for this meeting. So, Indian Stroke Association always advocate the awareness and the treatment part for the stroke. This is for the first time where Indian Stroke Association thought of partnering with Voice of Healthcare, and we thank Dr. Naveen Nishchal for doing that with us. A round of applause to the Voice of Healthcare. And I will fail if I don't mention Pinky, who's the Deputy Director for VOH, and Khushbu, who had made all their efforts to make this possible to have this meeting today. We thank you for that. So if you think the Indian Stroke Association always thought about the awareness and the treatment, this is first time we are getting innovation, partnership, and policy. We always thought that I can give you one incident when we had a conference in Chennai this March. There were two non-neurological people who talk about the stroke accreditation quality. That was Dr. B.K. Rana and Mr. Neeraj Lal. And at that point, we had a discussion कि you neurologists discuss among self about the treatment, about the awareness, but how you reach to the people who help you to treat stroke. The partners in the form of the nursing care, which are here, we thank them. The neuro rehabilitation is here. The innovators are here. Researchers from NIPER, Dr. Pallab is here. So all these make the part of the stroke journey very important. And this is for the first time from the quality to the researchers to the rehabilitation, all the stroke stakeholders are there in the room. And there are people who are there from the prevention side, like ICMR, the Hypertensive Initiative. They all are here in the room to share the views with you that stroke is not only a treatment for the neurologist, it's a comprehensive treatment where the neurologists need all the other branches to make the survivor live a normal life. And I think Rohit, when speak, he will discuss about that part, how the comprehensive treatment, not in the form of the neurologist and other stakeholders, help you to get on your feet and walk and do your activity of daily living. Because it is not only opening the arteries at the interventionist, that is one part, but it is at 3 months, the patient is able to do the activity of daily living by his own. And these are all the stakeholders. And I again thank all of you to be here and give a huge round of applause to all of you who are here for this meeting. And in today's journey, whole day, all the stakeholders will give their view and will try to improve the quality and the nature of care which we are giving to the stroke, not only acute, chronic, and how we can make the life of stroke survivors much better. Thank you very much. Jai Hind.
Thank you so much, sir. I'd now like to welcome in center Dr. Anand Alurkar for a sir's special address. Can we have a round of applause for Dr. Anand, please?
Thank you, Voice of Healthcare, for having me here. It's a pleasure. Dignitaries on stage, dear friends and colleagues in the audience. It gives me great pleasure in addressing you as President of the Indian Stroke Association. Let me start by introducing this body which I represent. It is a 20-year-old association of people interested in the prevention and treatment of stroke, around 1,500 in number, who are passionate about stroke prevention and treatment. It consists of neurologists, neurosurgeons, physiotherapists, physicians, etc., etc. Anyone who is interested in the treatment of stroke can become a member. It is in the forefront of stroke education, quality accreditation, public awareness for last couple of decades, since its inception. It is therefore apt that ISA is supporting this endeavor by VOH on the occasion of World Stroke Day, which is 2 days hence. It will not be an understatement to say that stroke is one of the biggest healthcare challenges that faces us today for various reasons. Just consider the figures. 15 lakh new patients per year, and this figure is likely to be an understatement because of the problem of underdiagnosis and underreporting. 15 lakh per year. Incidence has almost doubled in the last decade. At least 15% of these patients are in the less than 40-year age group, productive years. It is one of the most commonest causes of death, 8% of all deaths. The deaths are more than tuberculosis, HIV, and malaria combined. You go to any major hospital in any major city, you go to the ICU, majority of patients will be stroke, even more than myocardial infarction patients. Disability, 50% of patients are left disabled after a major stroke. Of course, this number does fall to around 25% if the patient receives advanced treatment in the first few hours, like IV thrombolysis, mechanical thrombectomy, etc. But the problem is less than 5% of patients reaching the hospital in our country end up receiving this treatment for various reasons. This is a huge treatment gap. It is probably the disease which has the biggest impact on the country's GDP. I don't have any figures. I tried to find, but I did not find any authentic figures. Probably such a study has not been done, but as treating doctors, we see day in and day out how major stroke affects the livelihood of patients when they go back. The whole family is disturbed, the finances are shattered. And it will not be an understatement to say that this is the single most common medical reason for affecting the nation's GDP. Either the figures have not been studied or they have not been disseminated, but I would be very much interested in knowing these figures. Of course, it is not all dark news. A lot of advancements have taken place in the last 10, 15, 20 years in the prevention and treatment of stroke on various fronts, whether it is medical, interventional, nursing, rehabilitation, neurocritical care, etc., etc. However, we in India are falling short of ensuring the last mile delivery of all these advancements. That is why events like today's, where stakeholders from various aspects have been brought together for brainstorming. I hope we have a successful meeting today. And on behalf of Indian Stroke Association, I hope this meeting adds value to all our efforts towards stroke awareness, prevention, and treatment. Thank you very much.
Thank you so much, sir. I'd now like to welcome and dais Dr. Jeyaraj Pandian for sir's address. So please come up. Can we have a round of applause, please?
Good morning, everyone. Respected Dr. Naveen Nishchal, Chairman, Voice of Healthcare, President of ISA, Dr. Anand Alurkar, Secretary of ISA, Dr. Arvind Sharma, and Mr. Neeraj from Apollo Hospitals, and many other dignitaries, Mr. Rohit Shukla from the patient's side, that is a stroke support organization. It's my privilege to participate in this program, not only as part of ISA as a past president, but I also represent World Stroke Organization as the president-elect. World Stroke Organization is a global organization, so One Voice for Stroke. We are involved in multiple activities, stroke awareness, the World Stroke Day that every year, October 29th, the theme is selected by the World Stroke Organization. We have 2 years campaign on a particular theme and try to cover every aspect of stroke globally. And another important area that we work is education, research, advocacy, stroke support organization. If we look at the projections, recently World Stroke Organization and Lancet Neurology Commission, we jointly published on October 9th during the World Stroke Congress in Lancet Neurology, the projection figures for stroke. If this trend continues, there would be 10 million deaths annually by 2050, mostly in low and middle income countries due to stroke. The cost would be about $2 trillion per year. And the stroke deaths will rise from 6.6 million in 2020 to 9.7 million in 2050, and almost 90% of the stroke deaths by 2050 would be in low and middle income countries like India, Africa, Southeast Asia, and South Asian countries. If you look at the Indian figures, Dr. Anand Alurkar mentioned a very conservative figure of 1.5 million, but the actual figure is about 1.8 million. Again, I would say it's an underestimate, 1.8 million per year, 4,500 strokes per day. every 40 seconds, one Indian suffers a stroke. If you look at the deaths due to stroke in rural India, we have data from Gadchiroli, Maharashtra and Ludhiana rural areas. In Gadchiroli, 1 in 7 deaths in the villages are due to stroke, and in Ludhiana is 1 in 4. That correlates with the development of the state in the region. Punjab, the villages, the people are rich, and the Punjab farmers have moved away from hard labor work, and they have outsourced to people from other states. So there's a high prevalence of hypertension in Punjab. Stroke is highly preventable and treatable. In the Lancet Neurology Commission, there are several pragmatic recommendations that we had put forward, about 12 pragmatic recommendations. I will just enumerate few, which are very important. One is aspirin within 48 hours in ischemic stroke is very simple, low cost. Stroke units, intravenous thrombolysis, endovascular treatment, and rehabilitation. And establishment of stroke units at all levels of healthcare. In primary healthcare level, certain things would be possible. At district level hospital, you can establish a stroke unit so that we can give thrombolysis. And in tertiary care hospitals or advanced stroke center, everything is under one roof. There is an urgent need for financing from the government. We have government representatives here, and the Honorable Minister also will be here. Even though there are packages for stroke in India in the Universal Health Coverage Package, I chair a committee under National Health Authority for neurological diseases packages. We have revised the package 2 times. It has been implemented and announced, but not many takers from different states, even states with a very good healthcare system, completely public funded, still they are not able to take up, particularly thrombectomy. Because of fear of reimbursement, what happened? The reimbursement is not good. Probably that is one of the things that we need to address today in the discussion. In the last meeting about a week ago when we discussed, I clearly said 80% of strokes are managed in private sector hospitals, and thrombectomy are majority being done in private sector. So we need to have a reasonable reimbursement for thrombectomy cases. So a revised package will be very reasonable, and along with the reimbursement for thrombectomy and IVT, the stroke unit per day cost, that is also included, and probably to some extent rehabilitation. So the package as a whole, you can shift from one category to the other for stroke patients. So hopefully, if they implement, and there'll be more uptake of this particular scheme, and more patients will benefit. Recently, just before the G20 meeting in Delhi, the World Stroke Organization, we organized the advocacy of policy meeting, the ministerial meeting for Southeast Asian countries. From India, we had representation from 17 health ministries of the state, and 7 health ministers participated, and 7 representations from the Southeast Asian countries, they came. And Dr. Arvind Sharma was there as part of the meeting, and there was a New Delhi declaration that was signed by the delegates, and it was a very good, productive meeting, I would say. We were able to discuss issues related to each state in our country, and also the Southeast Asian countries. So the output from the meeting was that people have to go back and talk to the governments and implement the stroke care. If you look at the human resources, that is another challenge for our country. In India, probably we would have reached around 3,000 neurologists. There are 400 stroke units approximately. IVT capable centers about 595. EVT capable centers about 365. The physiotherapists about close to 15,000. OTs around 6,000. And speech and language pathologists about 1,700. There is a gross disparity. And if you look at the proportion of neurologists in South and North, probably I would say 60% of the neurologists are in South India. So the number of neurologists in Bangalore and Chennai is all more than 200, 300, and huge numbers, and there is so much of disparity there. And in a situation like this, how can we develop stroke services? We need to empower the physicians. That is the only way we can rapidly improve the stroke care in our country. And there are several states where the physician-led hub and spoke model has been implemented. Punjab is one such state. In 2016, there were 5 district hospitals with CT scans, and we were able to establish stroke units there. But now, with the PPP model, every district hospital, about 22 district hospitals in Punjab, there is a CT scan facility, and there are certain district hospitals there, MRI facilities also available. With the current government, we are working with them, and we have revamped and reinitiated this hub and spoke model with the Punjab government, and the TPA is free. We are working on the hub and spoke model of referring patients for thrombectomy from these hospitals. So one person can't do, neither ISA or WSO, we can't do it alone. We need to partner in this journey, and that is where we have researchers here. We have representation from patient group. We have representation from hospital administration, quality, and government. So let us all work together and improve the stroke care in our country. Thank you.
Thank you so much, sir. Now, as Dr. Arvind briefly mentioned, we also have the honor of having the patient voice himself with us. Mr. Rohit Shukla, please come up and share your immense experienceful journey with us. Please, with a huge round of applause, can we welcome Mr. Shukla?
Good morning, all. First of all, thanks to Indian Stroke Association, Voice of Health team, and Dr. Arvind Sharma for inviting me here today. Thanks a lot. So I'm here as a patient voice just to share my experience of pre and post stroke recovery. And I'm quite excited today to be in front of you all, as today I'm celebrating my first stroke anniversary. It's a year-long journey now today. So last year, same time, I was at my hometown in Lucknow to meet my parents during Diwali holidays. And post Diwali, suddenly I was unable to stop. My limbs were not moving, and I informed my wife that this hand is not working. So initially she took that I was just joking, but soon she understood that there is something serious, as my voice was stuttering and I was unable to speak and move my body. Fortunately, my father is a doctor, so soon he came up and just saw me, and it's just a matter of time in case of stroke, as everybody, all the guests are saying. I was rushed to the hospital and I got a timely treatment. I was thrombolized in a quick time. So it prevented damage, most of the damage. So I just want to share that it's just the timing. As a patient, what I can say is how fast you can act. In my case, my whole left side was paralyzed with the passage of, I think I was having 4 or 5 transient ischemic strokes attacks at that time. And the last one was which caused me the most damage. And within 3-4 hours, I was thrombolized at the midnight. And next morning when I woke up, I came to know that my left side of body was not working. So this is a pre-stroke story, and the most important is a post one. Post-stroke is the most important thing, where, as our theme says, that innovation, policy, and partnership. That is the most important thing. As a patient, I can say, when I came to Ahmedabad, and I was in the mentorship of Dr. Sharma. So he guided me that you have to go for rigorous physiotherapy. So when I started with the physiotherapy, it was initially the innovation which I saw in the medical field, that robotics was there, machine learning and artificial intelligence, those things were incorporated there. And it was just like a video game for me, the gamification things as an innovation, which I enjoyed and I recovered from that. The number of movements which I got with this robotics therapy, it was nearly 2,000 movements in a half an hour session I was getting, which helped me in recovering my legs and my arm. And the only thing which I want to convey to the audience or the patients who can just, that's my learning which I want to share, is that first one was the timing. Second one is a post-stroke neuro rehab, which helped me to recover from this. And then the major thing which I was asking Dr. Sharma every time that, sir, what was the cause of my stroke? Then he told me that, he asked me initially, first of all, what I am doing and what is my profession. I am a pharma profession and I am working as a project manager with Dr. Reddy's laboratory right now. So he asked me what I used to feel previously before stroke. Then I gave him all the information. I told him that in morning I used to have a lot of sleepiness, drowsiness. Then he instantly asked me to go for a sleep test. Then finally I got to know that I am suffering from obstructive sleep apnea. And my wife used to initially complain that I used to snore in a particular fashion during night. So I took it very casually. It was a carefree attitude that, okay, it's everybody in India can snore at night. So just to let you know, guys, don't treat this snoring as an ordinary thing. It can be a serious one, like it happened with me. And now since a year, I am using the CPAP machine, which is again an innovation, which is helping me to recover from all these things. And I stopped taking antihypertensives or anti-diabetic because I was a baseline diabetic at that time. So after using, because of OSA, I was having the manifestations were diabetes and hypertension to me. So right now I am standing in front of you and I am still working on this rehab program, and my left limb is still not working properly. But as a patient, I want to tell you that you should have a basic targets to improve on this post-stroke recovery. My first target, which I told to my rehab therapist, was that I want to drive again. So within 3 months of my treatment, I started driving, and today in morning I came here driving on my own. Second thing was I wanted to shed off some of the weight. I lost around 15 kgs in last 6 months. Third thing is still that is work in progress. I wanted to type from both of my hands. So for that I am still working in a neuro rehab center and under the guidance of Dr. Sharma, which he fondly asked me just to do household works. It will help you in getting back your hand movements. And the last but not the least, I wanted to go back to my office in person. I am thankful to Dr. Reddy's team, my HR team, who are allowing me to work from home right now. So that is the two motivations still which I am working on right now. It is work in progress. And I can happily say to you guys that today at least this hand was not moving an inch. Right now I can wave off to all of you. Now coming to the policy maker, since all distinguished guests are here, I can say that in the capital city of one of the biggest state, UP, Lucknow, I didn't find a single robotic center for my physiotherapy. So I came back to Ahmedabad, where my wife is working with Zydus Group. I started my rehab here in Ahmedabad, and soon I can see the change. What I am requesting, since you guys are the key stakeholders and policy makers, that this should be available to most of the patients, as one of our guests was speaking. And second thing, it should be affordable and to all of us, because it can have a serious financial burden on the patient. So guys, thank you for inviting me here. And today I am more happier in front of you rather than when I was 1 year old, because at that time I was not, would have been in my senses, but today in my senses I am more happier and excited to be celebrating my first year anniversary with you guys. So thank you.
Thank you so much for that, Mr. Shukla. I'd also now like to welcome on stage Mr. Neeraj Lal to please deliver his word of thanks and the opening address. Thank you so much. Can we have a round of applause for Mr. Lal, please?
Very good morning and welcome to this vibrant city, India's first World Heritage City. And thank you, Mr. Rohit. I think that is the way we are here. It just take one day to be here and talk about stroke. I'm taking a line from Cricket World Cup, okay? So I think this is very, very important, what he told and what are the issues, what are the concerns, right doctors, right technology. That's all we are here. And I think 1.5 years ago, in one of the tea posts here, myself and Arvind was talking about, like I am from the management part of healthcare. We talk about PNL, we talk about EBITDAs and all. So always, cardiology, like PAMIs get importance, in our dashboard, we talk about CAGs and PTCA. But somehow, I think, whenever we say stroke, I think most of the people don't know. So, like, one of the way we started saying brain attack, because I think people know what is brain attack. If heart is close to you, brain is also close to you. So I think we use these complicated terms which make people away from what we are. In the last 1 year, thanks to Indian Stroke Association, I have attended more stroke conferences than my management conferences. Because, we are a part of quality journey, and myself and Dr. B.K. Rana is a part of Quality and Accreditation Institute. We became part of it. And as I'm speaking, 10 hospitals in the country are accredited by QI for advanced stroke center and primary stroke centers. I think that is one of the way we can contribute to the stroke. And ISA's very, very robust team. I have met these doctors in these conferences, and I have seen most of the doctors sitting late night and taking a assessors training course. I think that is a thing which is very, very important. So I want to thank Voice of Healthcare, Dr. Naveen Nishchal. I think he is doing a wonderful work apart from his entrepreneur journey. And this conference is not just conference. I think we are bringing people together. This is the first conference which we are talking about brain attack, and in which the students, the policymakers, the doctors, the managers, as well as the tech, which is bringing. Like he was sharing about the city of Lucknow, where they were struggling with a neuro rehab center, which had advanced technology. So I'm sure if we can all come together on the same page, and I'm sure Voice of Healthcare will make a white paper and present to the health minister of the state, and we can make a difference in our own way. So I want to thank you once again for your invaluable contribution and participation. I think together we can make a difference, and together we can change the course of stroke care in our nation. Thank you and have a wonderful day ahead. Thank you very much.
Thank you so much, the stellar panel, the inaugural panel for today. Now we'll begin the felicitation ceremony. I'd request everybody to please come up in the center and request Dr. Nishchal to kindly felicitate the co-panelists for the inaugural session. Dr. Arvind Sharma, please come up in the center. Dr. Anand Alurkar. Dr. Jeyaraj Pandian. Mr. Neeraj Lal. And Mr. Rohit Shukla. I'd like to invite Dr. B.K. Rana sir to kindly come up on the stage and felicitate Dr. Nishchal. Can everybody come in the center for a group picture, please?